Hello, I'm Dr. Rajiv Agarwal, Professor of Medicine and practicing nephrologist at the Indiana University School of Medicine in Indianapolis, Indiana. Blocking the renin-angiotensin system, RAS, has been the backbone of treatment of patients with diabetes and CKD. The final step in the activation of RAS is the release of aldosterone that stimulates the mineralocorticoid receptor, MR. Current therapies that block MR have failed to protect the kidney in part because of hyperkalemia. Finerenone is structurally different from existing MR antagonists because it lacks the steroidal nucleus. Therefore, it is called a non-steroidal MR antagonist. In animal studies, this drug blocks inflammation and fibrosis in both the heart and in the kidneys, and it does so by having only small effects on serum potassium. The FIDELIO DKD study performed in 5,734 patients with advanced CKD and type 2 diabetes showed that finerenone protected both the heart and the kidneys. The relative risk reduction was 18% for the kidney failure endpoint and 14% for the CV endpoint, and both were statistically significant. Furthermore, finerenone also reduced albuminuria by more than 30% at 4 months and had minimal effects on blood pressure and no effects on glycemia. Discontinuation rates of the drug attributable to hyperkalemia over a median follow-up of 2.6 years was 2.3% compared to 0.9% with placebo. In other words, one would need to treat 71 patients with finerenone before one stops the drug due to hyperkalemia. In comparison, one would need to treat just 29 patients before one avoided the kidney failure outcome and 42 patients to prevent one CV outcome. Thus, physicians who treat patients with type 2 diabetes and CKD have a new tool to reduce the rates of progression of both CKD and heart disease. This is an exciting and promising discovery for patients with CKD and type 2 diabetes. The sister study of FIDELIO DKD is called FIGARO DKD, and is being performed in even an earlier stage of CKD. The primary purpose of FIGARO DKD is to demonstrate whether finerenone can protect the heart. A secondary purpose is to demonstrate whether it can protect the kidney. The results of the sister study will likely be available in 2021 and should provide even more information about the safety and efficacy of finerenone in an earlier stage of CKD. Thank you for your attention.